Vein 911 Vein Treatment Centers are an award-winning and world-renowned practice. Your Vein 911 vein care specialists are among the best in the world. Vein 911 Vein Treatment Centers are among the best in the world at providing state-of-the-art venous and lymphatic medical care and cosmetic vein treatments. Vein 911 provides world-class venous and lymphatic care based on systems and protocols which were developed, tested, proven, and then constantly refined by me. There are more people suffering from venous and lymphatic disease and cosmetic issues than I can possibly care for all by myself. You may see me and world-class physician assistants throughout the course of your care, all of whom are carefully chosen, directly trained, and certified by me. Our vein care specialists, physician assistants, and physicians go through months of training with me, and they also receive training nationally through the American Vein and Lymphatic Society, where I serve on the board of directors. At Vein 911, physician assistants are extenders of the physician, not physician replacements. Physician assistants diagnose and treat medical and cosmetic vein disorders under the supervision of a physician, earn a master's degree in medical sciences, have over 2,000 hours of clinical training, and are certified by the National Commission on Certification of Physician Assistants. I welcome any compliments you'd like to share with me about our fantastic staff by calling or texting my cell phone at 813-833-1249. I'm also open to your concerns as well. Have you ever wondered, why do I have vein disease? Well, heredity is the number one cause of vein disease. 70% of Americans suffer from vein disease that they, and often their physicians, do not even realize. Vein disease is like needing glasses. Most people did nothing to deserve it. Your genetic makeup may cause you to have weaker vein walls that widen and valves that leak over time. If you're a woman and have ever been pregnant, the powerful hormone progesterone during pregnancy causes your veins to enlarge. After delivery, your veins decrease in size but remain larger than before your pregnancy. In fact, vein disease is the only disease caused by parents and children in a lady. A bit of a joke, but it's true. If your occupation requires prolonged standing or sitting, this will exacerbate your vein disease. When standing or sitting for long periods of time, blood pools in your legs, and the pressure can damage your vein walls and valves. Age. Everything sags as we age, including our veins. Vein disease progressively worsens with age. Over 50% of Americans over the age of 50 will have vein disease. Obesity and being overweight is not good for anything, including your veins. Although not a primary cause of venous disease, obesity is definitely a contributor. Excess weight causes added venous pressure that weakens your veins. Lastly, trauma or injury of any kind to your legs may damage your veins. Injury includes surgery of any kind in your legs that may also damage your veins. If you are genetically predisposed to vein disease, it is often worse on your leg that has been injured or operated on. Understanding how your leg veins work is fundamental to understanding your vein disease. In fact, what is vein disease? Your circulatory system is made up of arteries and veins. Arteries carry blood away from the heart. Veins carry blood to the heart. You have two vein systems in your legs. The deep vein system is deep in your muscles, and they carry 98% of your blood back to your heart. Deep vein disease is uncommon. Blood clots, DVT, may form here. Your superficial vein system is close to your skin. It's between your skin and your muscles, not in your muscles. Your superficial vein system carries less than 2% of your blood back to your heart. Superficial vein disease is very common and causes varicose veins and many symptoms and signs that patients suffer from that they, and often their physicians, don't recognize. Vein disease is the improper functioning of veins and their valves. The valves in our veins are the only thing preventing the backflow of blood. When our veins enlarge, valves do not shut completely, and blood leaks through the valves down towards your feet. Vein valve leaks usually start at the top of your leg, and blood leaks through the valves. This is similar to a leak in the attic causing a flood in the basement. A waterfall is another analogy. We tend to see problems and feel issues in our legs below our knees when we have vein disease, but the problems start above the knees. Did you know we actually have 3 hearts? We have a heart in our chest and one in each of our calf muscles. Your calf muscle pump is your heart in your leg. Calf contraction compresses the deep veins in your calf. Blood moves up and out of your leg veins. The valves keep the blood from moving backwards. Now you know why standing and sitting and not moving your calf muscles causes problems with your veins. Many patients wonder if they can prevent their vein disease. Unfortunately, vein disease is primarily genetic and you cannot pick your parents. There is no evidence that any drug, vitamin, or nutraceutical will slow the progression of your vein disease. Vein disease is a chronic progressive disease process. However, you can take some conservative measures to slow the progression of your vein disease. Walk, exercise, swim, activity of any kind is good for mind, body, spirit, and veins. Remember, we have 3 hearts, the heart we all know about in our chest, and the 2 we forget about in each of our calf muscles, called the calf muscle pump. Contracting your calf muscles keeps your blood and lymph fluid from pooling in your legs, which can lead to damage to your veins and unwanted symptoms. Be a ballerina, point your toes repeatedly, or a NASCAR driver, pump the brakes with your feet. You can do this even while sitting. Anyone in any condition can do this. Remember to sit the proper height. We often sit too high and put pressure on the back of our thighs. We should sit on our butt bones, not our thighs. Prolonged pressure on the back of your thighs compresses venous blood outflow and lymph fluid outflow, which may cause or worsen leg, ankle, and foot swelling. Put a sheet of paper under your thigh directly behind your calf, where your knee bends. If you cannot pull the sheet out without tearing it, your chair is too high. Your knees should be about a ½ inch higher than your hips when sitting down. Most chairs are not adjustable, so put something underneath your feet. Sit the proper height anytime you are sitting down, at work, in your car, during air travel, and at home watching TV. Wear graduated compression hose. A quality pair of measured and fitted, medical grade, graduated compression hose are a wonderful thing. Ask your vein care specialist for details. Achieve and maintain your ideal body weight. An ideal body weight improves your mobility, allowing more exercise, which prevents blood pooling in your legs. If you need to lose weight, it's just a decision. Activity and weight loss helps many things that are negatively affecting your life. Ideal body weight and exercise improve mind, body, spirit, and definitely helps your vein disease. The good news is that Vein 911 can stop your vein disease today using non-surgical, virtually pain-free methods not available everywhere. Our protocol and treatment methods give you the most complete and longest lasting results available anywhere in the world today. The future of vein care is available to you at Vein 911. Ask your vein care specialists for details. Hose both diagnose and improve vein-related symptoms you may be having. High-quality, medical-grade, graduated compression hose are measured, fitted, and comfortable. After medical or cosmetic vein treatment, hose help you feel better, recover faster, look better quicker, and prevent blood clots. Which hose are right for me? Quality compression hose are graduated, so the pressure in the hose fabric decreases as the hose go up your leg, which pushes your blood and lymph fluid up towards your heart. Over-the-counter hose simply compress at the same pressure along the full length of the hose. They are typically poorly fitting, hot, and uncomfortable. There are only 4 high-quality medical-grade graduated compression hose companies in the world: Juzo, Sigvaris, MediUSA, and Jobst. Compression hose can be thigh-high, which are necessary for most patients who will need medical or cosmetic treatments. They can be knee-high, which are important after vein treatment for maintenance of leg health. Pantyhose can be used, but they are generally not recommended, but are an option for some. Open-toe hose are more comfortable. However, open-toe hose are not open foot, so only your toes should stick out of your hose. If your hose right up your foot, pull them down to the base of your toes to prevent discomfort and foot swelling. Your vein care specialist will advise you of the best hose for your situation. Remove compression hose if they cause pain, numbness, tingling, or if you cannot sleep comfortably if you choose to wear compression hose overnight. It is important for you to know that most insurance companies require a conservative trial of compression hose before they will authorize treatment of your veins. Your treatment will not be covered by your insurance company without a medically monitored, graduated compression hose trial lasting from 3 to 12 weeks. Other conservative measures are required as well to address your vein-related symptoms before your insurance company will approve paying for your treatment, including lifestyle modifications such as exercise, avoidance of prolonged standing, weight loss, and even elevation. Our medical-grade graduated compression hose are world-class, custom-measured, comfortable, and even stylish. Frankly, we don't like selling compression hose at Vein 911, but we sell compression hose because people go out and get bad ones. There's over 200 bad hose companies and only 4 good ones, and they're all based in Germany and Switzerland. Patients with vein-related symptoms usually feel better when wearing quality hose. Medical documentation of your conservative trial is required to support our insurance authorization request to cover your treatments, so you will be scheduled for 2 office visits generally before your treatment. At your mid-hose trial visit, we assess your symptom response when wearing compression hose. We discuss your treatment plan and what to expect. At your final hose trial visit, we review consent forms, answer questions, and take pre-treatment photos. Most insurance companies take 1 to 3 weeks to review and approve your treatment plan. So we schedule your procedure anywhere from about 1 to 3 weeks after your final hose trial visit. Your treatment protocol will include a consultation where you will meet your vein care specialist and receive comprehensive medical and cosmetic vein evaluation. An ultrasound exam will be recommended if your issue is medical. Your ultrasound exam of your legs will be performed evaluating vein size and leaky vein valves. An ultrasound follow-up visit will include a custom vein map report, which is reviewed with your vein care specialist. Conservative management and minimally invasive treatment will be discussed if your report is positive for vein disease. Your treatment protocol includes conservative treatment measures. Most insurance companies require a conservative trial of compression hose and other measures. Your treatment will not be covered by insurance without conservative treatment lasting anywhere from 3 to 12 weeks. Our medical grade graduated compression hose are world-class, custom measured, comfortable, and even stylish. Most patients with vein symptoms feel better when wearing high-quality hose. Appointments throughout conservative treatment sometimes can be completed virtually. Your vein treatment typically includes thermal ablation and ultrasound-guided foam sclerotherapy. Most patients need 1 to 2 thermal ablations and 2 ultrasound-guided foam sclerotherapy sessions to complete treatment of a single leg. It may take 3 to 5 visits to fix a single leg, and if we're still friends, we go to the second leg. That's a bad joke. Obviously, we're usually still friends. There is no downtime after your treatments, none at all. The only lifestyle change is going to be generally thigh-high compression hose. That's it. Other than that, it's walk in, walk out, go to the game, play in the game, whatever you want to do. You return to normal activities immediately following each treatment, and treatments are virtually pain-free. However, if you are nervous for any reason, ask your vein care specialist and we can prescribe some medications. After your treatments, an ultrasound exam of your legs will be used to document closure of your treated veins. Follow-up visits are important. Your vein care specialist will evaluate your progress at 2 months, 6 months, and 12 months after your last vein treatment. Follow-up appointments sometimes may be able to be accomplished virtually. Discount spider vein treatment sessions are offered for those medical patients seeking to look better and to become our walking advertisement. Note that one session is never adequate to get rid of all cosmetic spider veins. Cosmetic spider vein treatment packages are available to those who desire additional sessions. Cosmetic spider vein treatment is never covered by your insurance. Ask your vein care specialist for details. Ultrasound-guided foam sclerotherapy is the future of vein care, available today at Vein 911. VenaThrive is the exclusive ultrasound-guided foam sclerotherapy method developed by me, a recognized national and international expert on ultrasound-guided foam sclerotherapy. Surgical vein stripping in an operating room should never be performed today because of new technology developed about 20 years ago. Vein stripping surgery used to be limited to those suffering only the most advanced vein disease, and the surgery resulted in weeks of recovery and discomfort. And worst of all, more than 60% of patients developed a recurrence of their varicose veins. Vein treatment was revolutionized around the year 2000 with the development of thermal ablation. Thermal ablation is the elimination of abnormal straight veins inside the leg using a straight laser fiber or straight radiofrequency electrode, elegantly closing the abnormal vein and improving venous circulation in your legs. Almost every patient who is treated for lifestyle-limiting vein symptoms receives thermal ablation these days. However, thermal ablation can only eliminate an abnormal straight vein, and thermal ablation is not a standalone procedure. Virtually every patient needs an additional procedure to properly treat invisible branch veins coming off the single straight vein. These branch veins, hidden under the skin, ultimately feed into varicose veins, also hidden under your skin, as well as visible varicose veins that may bulge your skin. There are only two other methods beyond thermal ablation to treat veins or abnormal veins today. One is phlebectomy, which only removes visible bulging veins, and two, ultrasound-guided foam sclerotherapy, known as VenaThrive in our office, which is the only vein treatment that can eliminate all of your abnormal veins. VenaThrive can eliminate straight veins, branch veins, invisible veins that you can't see on your skin, as well as visible varicose veins. Phlebectomy is commonly performed still in this country. It is an in-office surgery of visible varicose veins that is pleasantly termed microphlebectomy or ambulatory phlebectomy, but it is in fact surgery. Small skin incisions are made in your skin, and a small metal hook is used to pull visible varicose veins out. Removing varicose veins with phlebectomy is like removing the tip of the iceberg. It leaves most of your problem veins hiding under your skin. Worse than that, phlebectomy simply does not remove branch veins and varicose veins that can only be seen with an ultrasound machine. Hidden branch veins and varicose veins that are beyond the reach of thermal ablation and phlebectomy will enlarge over time, may eventually bulge your skin again, and worse, a patient's lifestyle-limiting symptoms that initially improved will come back all over again. Possible risks of phlebectomy include scarring, bleeding, hematoma, infection, nerve injury with numbness, and lymphatic disruption, which could result in a small fluid collection, swelling, and even seeping of fluid through a puncture site. Ultrasound-guided foam sclerotherapy, which is known as VenaThrive in our office, is performed after RF ablation, and we never perform phlebectomy at Vein 911. VenaThrive can eliminate all abnormal veins and was refined about 30 years ago. VenaThrive uses ultrasound to identify hidden abnormal veins, and a tiny needle is directed into the abnormal veins, and a special foam is injected, instantly destroying the abnormal vein. Foam is absorbed by your blood in a matter of seconds, and nothing is left behind in your body. Your body absorbs the treated vein over several months. No surgical incision is made with VenaThrive, and all abnormal veins can be treated. Nearly 1 in 3 new Vein 911 patients has recurrent vein problems from prior treatment at other centers where they only used thermal ablation and/or phlebectomy. This is because those patients never received VenaThrive or ultrasound-guided foam sclerotherapy as part of their treatment plan, and hidden abnormal veins were left behind in these patients. Dr. John Bergen is widely regarded as the father of vein care in the USA. Around the year 2000, he described the effectiveness and success of foam sclerotherapy treatment to physicians. Foam has since gained worldwide popularity, but is not commonly used. Quoting from one of Dr. Bergen's many authoritative textbooks on vein care, Foam Sclerotherapy, a textbook, Dr. Bergen said this: "The advent of foam sclerotherapy has been one of the most important developments in the field of venous and lymphatic medicine. Just as surgery has evolved into more minimal invasion, so has the treatment of varicose veins. Ultrasound-guided foam sclerotherapy is quick, efficient, easy to use, and inexpensive, and is widely believed to become the dominant form of therapy for varicose veins." Are my cosmetic spider veins caused by medical vein disease? Did you even think that cosmetic spider veins could be caused by medical vein disease? You bet they can. Why is my cosmetic vein treatment not working? The gold standard for leg spider vein treatment is injection sclerotherapy that causes your spider veins to close down, and then your body absorbs the closed veins over many weeks. If your spider veins do not respond to treatment, you have underlying leaking veins that are feeding your spider veins that keep your spider veins open. Your spider veins are like weeds. They have roots. If these roots are large and leaking, injection sclerotherapy will not be enough to close down the roots, and your spider veins will not go away. Do I have underlying medical vein disease? If you have any of the symptoms below, you likely have deeper, hidden medical vein disease. Symptoms include itching, heaviness, tiredness, aches, pain, burning, pins and needles in your legs, ankle swelling, night cramps, and even restless legs. If you have any of the signs below, you likely have deeper, hidden medical vein disease. Signs include any cosmetic spider veins below your knees, any detectable ankle swelling, and any unusual skin pigmentation or discoloration in your lower legs. If medical veins go untreated, your spider veins usually will not go completely away. New tiny spider veins may form, called matting. In fact, spider veins may become worse if you attempt treatment without dealing with the medical issue underlying the spider veins. Normally occurring temporary pigmentation of your skin that occurs after spider vein treatment may not go away or may actually worsen over time if you don't deal with medical vein disease. Graduated compression hose, what everybody should know. How do your graduated compression hose work? Your legs have many veins or tubes which return blood to your heart. When your venous tubes are compressed by your graduated compression hose, your blood moves faster back to your heart, which has many medical and even athletic performance benefits. Wearing your graduated compression hose is like putting your thumb over a garden hose. Compression hose makes your blood flow faster in your veins. Simple compression and graduated compression, a big difference you need to be aware of. Wearing graduated compression is critical. Compression should be greatest at your ankle level and gradually decrease between your ankle and your knee. Graduated compression hose actively move venous blood and lymphatic fluid out of your leg and towards your heart. Most compression hose sold are simple compression and not graduated compression. Make sure your hose are graduated compression hose. Why should you use graduated compression hose? There is substantial scientific evidence that high-quality measured and fitted graduated compression hose provide important medical benefits. Graduated compression hose use is like wearing a pill instead of taking a pill. Wearing graduated compression hose improves many superficial vein disease related symptoms, including itching, heaviness, fatigue, pain, throbbing, swelling, night cramps, and even restless legs. Wearing graduated compression hose improves skin changes of chronic venous disease, improves venous leg ulcer healing, and prevents venous leg ulcer recurrence. Wearing graduated compression hose also lowers your risk of serious blood clots or deep venous thrombosis, also known as DVT. Wearing graduated compression hose also improves the symptoms of those who currently are suffering from a DVT and helps stop the enlargement and extension of newly formed blood clot. Wearing graduated compression hose also benefits those who have suffered a DVT in the remote past. If you are a long-distance traveler, wearing graduated compression hose will help you prevent swelling, leg pain, and discomfort, and lower your risk of deep vein thrombosis or DVT. If you are a pregnant woman, you will also benefit from wearing graduated compression hose which will also help you prevent swelling, leg pain, and discomfort, and lower your risk of deep venous thrombosis or DVT. Many studies demonstrate improved human performance during muscular exertion when wearing compression hose. Athletic performance benefits of using hose during exercise include returning deoxygenated blood to your lungs faster, improving tissue oxygenation, reduction in muscle pain and fatigue by accelerating the clearance of metabolites that build up in your muscles during exertion, such as lactic acid, reduction in muscle oscillation upon ground contact during running, faster recovery times by reducing effects of delayed onset muscle soreness in the days following strenuous exercise. For you to obtain the benefit of less delayed muscle soreness after exercise, be sure to wear your graduated compression hose for at least 2 hours after athletic exertion to get maximal benefit from your hose. It is only a slight exaggeration to say that wearing high quality, properly fitted, graduated compression hose is like wearing a performance enhancing drug. How should you choose the right graduated compression hose? First, and very important, for you to benefit from a good quality pair of graduated compression hose, your legs must be measured for the proper fit. You must wear compression hose that are specifically measured to fit your leg size and configuration, or you will be uncomfortable and not get the proper benefit from compression hose. Good quality hose require you to measure your legs. A good quality hose brand will have multiple sizes based on careful measurements of your legs. Unfortunately, many patients buy poor quality and poorly fitting hose, and patients suffer as a result, become frustrated with uncomfortable hose, and stop wearing hose altogether. Which brands of graduated compression hose are the best? First, I would not rely on the internet to get a good answer. Second, it is suggested that you ask your vein care physician or vein care specialist which hose are best. If you are looking for graduated compression hose for only athletic performance, I suggest you find a hose company that also manufactures graduated compression hose used for medical vein disease. The amount of compression you use should be tailored to your specific needs. There are 3 classes of compression hose based on ankle level pressure within your hose. Class 1 are 15 to 20 millimeters of mercury. They're used for spider veins, varicose veins, and mild ankle swelling. Class 2 hose are 20 to 30 millimeters of mercury, used for large varicose veins, moderate ankle swelling, and after spider vein or varicose vein minimally invasive procedures or surgery. Class 3 hose are 30 to 40 millimeters of mercury, usually for severely symptomatic patients, severe ankle swelling, ankle ulcers, and lymphedema. Finally, how should you use your graduated compression hose? You cannot overwear your compression hose. However, if at any time your hose are very uncomfortable or you develop pain, numbness, or tingling in your feet or legs, you should immediately remove your hose. You can even wear hose overnight, which helps many people with night cramps and restless legs. Many patients and their doctors don't realize that both night cramps and restless legs are often related to undiagnosed hidden vein disease.